I'm Chris Sanchez. What I'm going to do today is do just a brief regulatory overview of all the different components of our compliance and quality department. Urgent care is regulated by organizations the same as any other healthcare facility. We have OSHA, we have the CDC, we have corporate compliance. So for our regulatory standards, we try to maintain the highest standards company-wide. We follow CMS protocol, we follow all your OSHA protocols, federal state regulations. We have a compliance committee that's organized that takes care of many different components of compliance, and I'll go through some of these. We have our policies and procedures, we have corporate compliance law, HIPAA, everybody's familiar with HIPAA and privacy requirements. We have quality management, documentation standards, we do chart audits, billing audits. Our human resource department keeps up with licensures and employee file requirements. We have required education, employee rights, patient rights. We really stress confidentiality. We have technology that we add every day to our processes for operational efficiency. We have laboratory standards, code of conduct. Our management team is trained on a regular basis, and we do have specific state and federal regulations. One thing that I'm going to go through with the group is how to access our policies and procedures. Our policies and procedures are electronic. We don't keep paper copies in the clinics. I'm going to go through the clinic drive at the end of the overview to show you where to access your policies and procedures. Compliance, one of the main components is our code of conduct. You'll be issued a copy of the actual code of conduct on hire with your onboarding information. Your code of conduct is going to be your standards, our operational standards, our ethical standards, our business standards. You'll be required to actually read the code of conduct and sign a certification certifying that you read the code of conduct and that you understand it. Every year annually, you'll also have to redo that compliance certification. And that is a requirement of corporate law, and we do follow that. So normally what will happen is when your managers are doing your annual evaluation, they'll go through your compliance certification with you in case you have any questions. We also have a means for employees to report compliance and integrity problems. You'll see on your UltiPro news page, there's all your reporting mechanisms. You have access to email, you have access to fill out a form to turn in or email, or there's also a confidential compliance line if you want to report something confidentially. There is a no retaliation policy here. No employee will ever be reprimanded for reporting another employee or any type of compliance or integrity concern. There is a corrective action process. Any concern that you have, there's a very strenuous corrective action plan. There's an investigation procedure, and usually within 2 to 3 days your concern is addressed if not corrected. These are the different compliance mechanisms. These are posted in every break room as well as on your UltiPro news page, and you can also access these on the clinic drive. We do follow non-discrimination policies here. We do offer access to employees and patients, any type of barrier of communication. We have language access services. If a patient comes in and they speak a different language, we can provide them translator services real time on the phone. Also, our patients can have translators on site. The nature of our business is a walk-in business. We don't take appointments, so if somebody does come in and they want a translator on site, we do have a guide that we have to tell them it may be 1 to 2 hours before we can have someone on site, but we can do immediate translations by phone. We also follow all ADA structural guidelines. We offer different languages, we have Braille, we have all the ADA requirements for handicapped accessible facilities. We do practice cultural diversity. You will actually get a training module on this through Litmus. We do cover a wide area. We do have a lot of cultural differences in our employees and our patients. Just always be mindful and respectful that your beliefs may not be the same as someone else's beliefs. Your idea of proper health care or follow through or how you are addressed in a facility is not going to be the same as somebody from another country. So just kind of keep that in mind and be respectful. And always remember, the patient is always correct. Okay, so be mindful of that. Just some different dimensions of diversity. People have different marital status, different background, different gender, race, age, sexual orientation. All these things you have to consider on a professional level and non-judgmental. Cultural competence, you'll actually go through this training with the Litmus module. We want our employees to be aware of all these different areas that you need to be culturally competent in, and you need to know how to handle those situations. And the litmus training that you'll go through will actually test you at the end of it to make sure if you're in the situation that you know how to handle that situation. And then we have HIPAA. HIPAA is our privacy component of our business. We do follow the notice of privacy practices. When a patient walks into our facility, we'll have a notice of privacy posted at the front desk. We don't give out paper copies unless they're requested, but they are posted at the front desk. If a patient wants a paper copy of anything to take with them, our front desk is equipped to print those out and hand those to the patients. We do acknowledge protected health information, PHI. We can issue that at a clinical level. We do ask that our employees maintain confidentiality in their practice. It's a need to know, minimal PHI. In other words, if you're talking to a coworker in the break room and they say something about a patient, don't go look up that patient's chart. Our EMRs are time-stamped. Only people that should be accessing the patient chart are those employees that had direct access to the patient care or management for investigative or quality management type situations. All patients have the right to make specific requests about their PHI. We can disclose at a clinic level. We can disclose PHI without the patient's specific authorization for anything considered treatment, payment, or a healthcare operation. Years ago, you would have to have a patient-specific consent every time you released a medical record. Those laws changed in 2013. You don't have to have that specific consent every time. You do have to have them acknowledge the notice of privacy. When they acknowledge that they read that, they're given their consent for you to use their PHI for treatment, payment, and healthcare operations. You're also allowed to use their PHI covered under the notice of privacy for any law enforcement or legal request. A specific authorization would be required for your patients if it's something that's not actually stated in that notice of privacy. And those types of things, or if an insurance company or a liability carrier or an attorney for a subpoena request a medical record, you do have to have a specific authorization for that. We actually have a medical records department here in the administrative office, and those types of requests like that would go through our medical records department. Any other just basic request about treatment or healthcare operations can be released to the patients at the clinical level. They don't have to come through medical records. If you ever have a question or concern about releasing someone's PHI to them, you can always get one of those authorizations just to make yourself feel more comfortable, and we'll scan it into the record. Or if you have any questions, if you're just not real sure, if it's a legitimate request, you can have an authorization filled out. If a patient has a specific request, we're legally required to let them fill out a request form. Those requests would be things like if they think that the record we gave them is not correct, they have the right to amend their records, they have the right to request a restriction to their records. That's also a different document that would have to be filled out. They also have the right to ask us not to bill their insurance company if they want to pay for something privately. And those specific request forms are also going to be accessible by the front desk staff, right at the front desk, so the patient can request that. We're going to do a quick regulatory review of OSHA. OSHA is your Occupational Safety and Health. It's the organization that governs all of our safety practices that we do in healthcare. We have a lot of safe work practices that we implement here. We have an emergency preparedness plan that we do actually use. We have flooding, we have hurricanes, we have tornadoes. We do implement an emergency preparedness plan at the clinical level. We have an incident commander here at the main facility at the administrative office. You will also get very detailed training on this through Litmus. This is just going to be a quick overview just to let you know we do have those processes in place. We have a hotline, we use social media, we use many means to get information across in an emergency situation. We have a notification call tree that will actually be posted in the break room as well. So you'll know who to call. If you have a bomb threat and you don't know what to do, you can go look at your little emergency call tree and it'll give you a detailed instruction on who to call and when to call them. Any clinic closures or reopenings are determined by the administrative level, by the incident commander. That wouldn't be something that's decided on the clinical level. So if you're working in a clinic and there's a hurricane coming, you can't just decide to close it. That has to be decided on the administrative level. Any extreme circumstance that would prevent you from arriving to work at your scheduled time that would jeopardize your safety, you would need to notify your manager for that. We do also have emergency codes and alerts that we practice. We actually have a drill done by the site manager each month. We do fire drills, weather alert drills, missing person drills, security drills. All these different drills we'll do throughout the year. These are done by the site manager and they are logged, and we do test our employees on those drills. So do participate. We also have a pretty extensive fire safety plan. You'll also do a fire training program in Litmus, the training program as well. We do have fire prevention devices, suppression devices, fire extinguishers at all of our facilities. We also practice our hazardous energy control. We have biomedical equipment inspections of all of our medical equipment so that it's deemed safe for patient use. We also have a process in place for medical device reporting if there is a problem with any of our equipment. We have a hazard communication plan. It's basically used to be called the material safety data sheets. Now they're called safety data sheets. We actually don't have a paper binder for this because it would be about 800 pages thick. We actually use an online e-binder through our waste management program. Employees have full access to this, and I'll also show you how to get to that on the clinic drive. We do practice safe ergonomics. We do a training on body position, proper patient positioning, proper lifting to avoid employee injuries. We have extensive training on hire and then annually, and then also throughout the year on bloodborne pathogens and other potentially infectious material. We do screen our employees through human resources for tuberculosis with TB skin test and a questionnaire. Even if you have a clerical position, you'll still have to do the annual questionnaire every year. We do have processes in place for infectious disease emergencies like Ebola. That does happen from time to time. We have processes in place. We have a specific plan with each state's Office of Public Health on who to call, who to contact. Your main thing that you need to remember as an urgent care facility is it's not our job to treat these patients. Our job is to recognize them, to stabilize them, and to transfer them. We do have pre-made infectious disease kits in the clinics to protect our employees in the incident somebody does walk in the door. We have specific processes in place for cleanliness, for infection control. We do practice no food or beverages in your patient care areas. That includes your front desk, that includes your nurse's station. You don't want to be eating or drinking when patients are walking through. You don't want to have a drink at the nurse's station and you come out of a patient's room and you pick your Coke up to drink it. We just practice that. That's something our managers are real strict about, and they will, reprimand you for having food or drinks in the clinical or patient areas. We do use only CDC and EPA approved cleaners. We have designated storage facilities for clean and dirty. We have a lot of compliance signage we post around the clinic, so it tells you, it basically guides you through what's a clean area, what's a dirty area. And it's the same everywhere. What we do at one place, we do it all. You can work here, you can work in Puerto Rico, you can work in Indiana. All your compliance signage is going to be the same. You'll recognize it anywhere. We have hand sanitation stations throughout the clinics. We use the hand gel. We have hand washing stations. We supply all your personal protective equipment. If there's anything that you would have to purchase separately. We have detailed waste disposal programs for regulated waste, hazard material waste, pharmaceutical waste. All that will be covered in detail through your training program as well that you'll do online. We do have risk management. We do track patient and visitor injuries and incidents, and we do track employee injuries and incidents. We do have processes in place for management, investigation, and corrective action of those. Your main thing that you need to remember as an employee, any incident at all, if you trip and fall, if you have a needle stick, the first thing that you do is you fill out an incident report, you get an evaluation on site where you are, and you call HR, and they will direct you from there. There's specific procedures that are outlined step by step for you. You don't have to go, wonder what you're supposed to do. I'm going to show you where to find that folder, and it basically is a detailed instruction sheet of what you do and what order you do it in. Same thing for needle sticks. We don't want you to wait 3 days if you have an exposure to something. We want you to have your blood drawn on site. We want the initial evaluation on site. And that will be different for some facilities that federal regulations require that they do go off-site for treatment.
Hi everyone, I'm Melissa Pollard. I'm one of our Director of Clinical Services here. I'm also a registered nurse, and I'm going to talk to you all today about operational efficiency. There's a lot of things in our clinics that make us operationally efficient. One of the main things that we have in our clinics is an electronic EMR. The main one we use at most of our entities is DocuTap, but you may find a little variation there. DocuTap is completely electronic, so when the patient comes in and checks in, our customer service representatives will check in the patient, get all of their information, scan in driver's licenses, any kind of insurance card, get everything ready. They'll put the patient on our schedule in the back. The nurses or the nurse techs will then triage the patient in the back. Everything completely electronic. As we're triaging the patient in the back, our physician can actually see the triage in real time. So they'll know if the patient's here for, they'll be ready to bring them back immediately when we step out the room after getting vitals. The other thing that it's great that we have now is an online patient registration, which we call web check-in. The web check-in, the patient signs online. They can check all of their information in, enter it all in. It comes up on our customer service side. They see the patient, pull them to our schedule, get a few little details when they check in, and then they go from there. Digital x-ray, another great thing that we have that makes us efficient. After our x-ray techs take the x-ray, it electronically pops up for our physicians to view the image. They can share the image if they need to, adjust the contrast if they need to, and really see that x-ray in detail way better than film could. So also in the clinics, we have our Press Ganey patient satisfaction surveys. Upon discharge, we do get the patient to perform these. It's really great because we'll get those results in real time. Employee scheduling, we have an employee premier scheduling system. You'll be able to log on, put your availability in for our managers to see. The schedule will be completely online. You'll be able to see any changes, submit if you want to change a shift with someone that goes to approval for your manager. All of these we try to get out by the 15th of the previous month so that you'll have your schedule way ahead of time. The last thing that we have that's brand new is our Litmus training system. So any of our compliance paperwork that we used to have to send through email for education and things like that will now all be on this educational platform online. You go on there, take a test, or acknowledge that you've seen the material, sign off on it, and then we can in real time have a tracking system of this, which we didn't have in the past. A couple things I'm going to talk about now is how our facilities are set up. So we have two types of facility setups. One of them is a freestanding, which is the majority of our setups. This doesn't have any kind of primary care attached to it or any kind of partner. It's just standalone. This is one of our particular floor plans. Set up for operational efficiency, has a very good patient flow. The other type that we have is a shared space, and this we'll share with our primary care offices, sometimes a specialist depending on the area that we're in. And the areas are kept separate, but we are sharing with another entity or a partner or someone like that. Really helps with referrals. When we do use a shared space, if it's a primary care, we can very easily refer to that clinic and they can be seen that same day.
I'm Elizabeth Perry. I'm the Human Resources Generalist for Premier Health and all of its affiliated entities. So you are in new hire orientation, and these are a few of the items that we're going to be discussing today. We have a little bit about Premier Health, who we are, and what we do for you guys specifically as an employee. We have our company overview, our affiliated clinics, our mission, core values, and then from human resources standpoint, which is what we're really going to focus on today, as far as the policies and procedures, ultimate software, payroll, as well as some benefits. That might be specific to not only our full-time employees, but also our part-time staff as well. We'll go through some operational efficiency, the initial login process as you go through the systems in our clinic. We have quite a lot of systems when you get really familiar with the clinic and the processes. So I'm going to go and walk you through that process as you log into each of the different systems. We're going to go through a little bit of customer loyalty and building customer trust with our patients. Then you'll go through a quick regulatory overview that focuses on the compliance side of things, from compliance and integrity, our code of conduct, the compliance certification process, culture diversity, civil rights, and non-discrimination processes as well. Then we'll go through some HIPAA with PHI use and disclosure, the employee HIPAA and confidentiality acknowledgement, and then finally we'll close off with some OSHA regarding the safety emergency preparedness processes, fire safety, hazard energy, hazard communication, OPIM, and bloodborne pathogens. Then we'll have the safe work practices and go through the full entire employee incidents process. So you might be wondering who Premier Health is. So we partner with various health systems, hospitals, and even physician groups across the country to provide an extension of cost-effective healthcare services in an urgent care delivery model. This can also be through occupational medicine that we offer as well for our clinics, but mostly we are considered the experts in urgent care services. So we have a full team in place. We have our medical directors, physicians, nurse practitioners, and physician's assistants. The great thing about our company and our clinics across the country is that our medical directors are actively working in the clinics with you guys. So they're getting hands-on in the trenches with you in the clinic, so they're able to report back to us on processes that need to be changed specific to those clinics that they're working in. We also have healthcare administrators. They're over the entire region or the specific entity, so they're going to help with the overall operations of the clinic. They're going to work very closely with a lot of our other managers in the facility as well to get a real good overview of the actual clinics in and of itself. We have our clinical compliance team. We're all really housed here in Baton Rouge, Louisiana in our corporate office. They're here as well. And they monitor the day-to-day operations of the regulatory and compliance processes with our clinics. For site managers, those are specific people that are assigned to each clinic. So they have a home clinic, they're concerned and focused on that specific clinic. They manage the day-to-day operations there, as well as any ordering processes of equipment, supplies, really anything that is tailored to that clinic. In the event that an employee is not able to get to their shift on time, that site manager is responsible for making sure that shift is covered at that clinic. Then we have a full marketing and business development team. This is one part of our company that works very closely with the people that we have partnered with. So the health systems and the hospital groups, they work very closely with those marketing individuals as well to make sure that the marketing processes are the same from health system to the urgent care center. So we provide that same standards of care. We have a finance and accounting team. We have our HR team, as I've mentioned. We have Lauren, we have myself as the HR generalist. We have Tashika Robinson, who is our payroll specialist. And then the only other person is Erica Robillard, who is our boss. She is the vice president of human resources. We have our information technology or our IT team also housed here in Baton Rouge, Louisiana. They're able to log into any of our computers across the country and fix anything that you guys may need. So it's a quick email or a phone call to our IT team, and they're able to really fix just about anything from Baton Rouge. So it's very convenient. We have our managed care and credentialing team also here in Baton Rouge. If you are a provider for our company, you will go through that very lengthy process here in Baton Rouge. The only other team we have here is the Revenue Cycle Services. That's our billing department. The great thing about our billing team is that everything is done in-house. It's here in Baton Rouge, so if a patient has an issue with their bill, they're able to pick up the phone, they're gonna call this phone number here in Baton Rouge, but they're gonna be immediately connected to a live person that's here, so they're able to have their issue fixed immediately. The great thing for our customer service representatives is that they're able to be connected with a billing person that's specific to their entity to go through any coding questions, verification processes directly with a live person here. So it's very beneficial not only for our patients but also for our employees working in the clinic. So these are our affiliated entities across the country. The things that are in the West, those are actually consulting projects that we've actually closed out. So we've gone in, we've helped a company open up an urgent care facility, or maybe an urgent care center wasn't doing too well, so they called on us to turn things around for them. So we have done some consulting projects in the West, but as you get into the East, you can see we have a lot going on right now. Most of our clinics are based in Louisiana, mostly being in Baton Rouge at this time. Lake After Hours is our first clinic that we opened 17 years ago. With Lake After Hours, we partnered with Our Lady of the Lake Regional Medical Center here in Baton Rouge to open up those clinics. We then opened up an occupational medicine clinic, which is down in Baton Rouge as well. Then we have LSU Health Baton Rouge, where we actually only manage the providers at that facility. So we don't have any ownership in that company. That is solely owned by Our Lady of the Lake, but we do manage the providers that staff that facility. We have Lake Urgent Care, that's out in Ascension Parish here in Louisiana, where we've partnered with St. Elizabeth Hospital to open up clinics there as well. They have 4 clinics. We have Lake Urgent Care North Shore. That is 100% owned by Premier Health. It's a clinic in Covington, Louisiana that we opened. There was a need there, so we went ahead and opened that clinic. We have Riverside Urgent Care, which is on LaPlace, Louisiana. We've partnered with Dr. Chris Swearingen to open that one facility there. We have Total Urgent Care and Occupational Medicine that is in Cutoff, Louisiana, and that is again solely owned by Premier Health. We have Lourdes After Hours, that's in the Lafayette region. We've partnered with Our Lady of Lourdes Regional Medical Center to open up 3 clinics there with the 4th one on the way. We have Lake Charles Urgent Care, where we've partnered with Dr. J. Mark. In Lake Charles, he has several clinics that are operating with more to come in the future. We have Rapides Urgent Care. We have one in Alexandria and one in Pineville. We've partnered with Rapides Regional Medical Center. For St. Francis Urgent Care, we've partnered with St. Francis Regional Medical Center to open up one urgent care center there. We have St. Vincent's Urgent Care, which is in Birmingham, Alabama. We currently only manage that facility, but we are looking to partner with them where we will open up more clinics in that area if that partnership does come about. We have IU Health Urgent Care. That is one of our biggest projects. You'll probably hear about that a lot in the clinics. We've partnered with Indiana University Health System, and they would like to open anywhere from 15 to 20 clinics within the next 5 years. We have been partnered with them for a little over 2 years now, and we have 5 clinics. We just opened the 5th one in July. We're set to open the 6th one this winter. So they are coming very quickly, and so you'll hear a lot about that when you get into the clinics. We have Pardee, where we've actually had a physician's assistant that went up there. We consulted with them to actually help them turn their clinic around. Then the last one is Premier Medical Center. That is in Puerto Rico. So it's down here, you can see right below Florida. And we are set to open up that one this fall. The great thing about our clinics is that they are all accredited by the Urgent Care Association of America, or UCAOA. So what does that mean specifically to you as an employee? The great thing is that this means we have standardized our care across the board. So if you work here in Louisiana and you turn around and you want to go to Indiana and you want to work there, you can, because it's the same processes. It really goes across the board along everything. The only difference is we may have a change in supplies, equipment that might be used, but the processes are going to be the same for your job discipline. So really great opportunity for our employees to move from company to company. What it means for our company in and of itself is that we have met and achieved excellence in all of the areas listed here, from governance to our scope of care. So the UCAOA team came down from Chicago and they tested us on these items. They wanted to know everything, pulled back the curtains, asked our employees questions, asked patients even questions about our processes, all the way from governance to scope of care. And like I said, we went through this testing phase and we achieved excellence on our first try. So all of our centers were accredited, and not only that, but the centers that we open from here on out will be accredited by the Urgent Care Association of America. Also, our president and CEO of Premier Health sits as president of the board for UCAOA. So our company mission is to provide an excellent patient care experience through convenient, quality, cost-effective healthcare services. We will strive to be the premier urgent care and occupational medicine provider to those we serve. So we accomplish our mission through our core values: customer loyalty, employee loyalty, and operational efficiency. So our core values are service, integrity, quality, and respect. So through service, we will service our community with skill, concern, and dedication. Through integrity, we will conduct business with the highest ethical standards. Through our quality, we are committed to achieve excellence in everything that we do. And with respect, we recognize the value, diversity, and importance of each other and our partners. So for scope of services, we have urgent care situations versus emergency situations. So you can see this list here. We also have this in each of our clinics. However, it all depends on the provider that you're working with in that given shift. So we have providers that come to us with all different backgrounds. Some have emergency room backgrounds, some have trauma backgrounds, some have been primary care providers for years. So it really depends on what they're comfortable seeing and treating in the clinic, on what the services that you'll be providing on that given day. These are our typical urgent care situations, and these are our typical emergency situations. The great thing is that we have a fantastic referral process with all of our clinics, where if we have this emergency situation arise, we can refer our patients out to the emergency room. In some of our clinics, we're able to bypass the wait time where they're immediately seen in the emergency room. We also have referral processes set up with orthopedists and different cardiologists throughout the area as well. So again, it all depends on the entity that you're working with, but if there is an emergency situation, we have the ability to get our patients to where they need to be in a timely manner. So getting into the human resources side of things, these are going to be your requirements as an employee. It is going to be your responsibility to maintain your licensure as required by your professional job discipline. We ask if you make any changes or updates to any of your licensures or certifications, that you send a copy of the updated certification to us here in Human Resources. So in your packet, you'll receive your new hire training checklist, which you'll be required to take to each of your training shifts from here on out. Your preceptor that you'll be partnered with on day one of your training clinical shift will eventually sign off once they feel like you are competent in the areas that are listed on your checklist. So in a year from now, from your hire date, you will go through an annual training. These trainings typically occur in June and July, so depending on when you're hired will depend on when your actual annual training, if you'll need to go through annual training or not. So you'll complete this annual training. It's a skimmed down version of your new hire training checklist. It takes about 2 hours to complete, and as I mentioned, it'll be in June and July of each year. That's typically our slow seasons in our clinics. Then during the month of your birthday, you will be required to complete an annual TB skin test and/or the TB questionnaire that you received during your new hire processes. This will be decided again based on the month of your birthday. If you have a separate schedule, maybe with your full-time job, you're able to keep that schedule as well. We just need to make sure that it's updated on an annual basis, and those updates are sent over to us in Human Resources for your employee file. You will have yearly evaluations completed by your direct supervisor. They will set that time up with you once you've met that annual requirement. So some specific policies and procedures that we're going to go over in Human Resources. When we get to the compliance and regulatory section of our presentation, you'll actually learn where to access these policies and procedures when you're in the clinic. So specific to human resources, you are employed at will. You can come and go as you please. As a provider with our company, you will need to provide us with a 4-week notice of your termination. For everyone else, it's 2 weeks notice of your termination. If you don't give us that notice of termination, when your paperwork comes over to us in human resources, we will have to check that you are not eligible for rehire with our company and its affiliated entities. So specific to dress code, we ask that you reference the email with specific uniform guidelines that was sent out to you from Human Resources. That will give you specific rules and regulations for your uniforms at your specific entity. You will receive your employee badge, and once you receive that badge, you'll be required to wear it for each of your shifts. It is just an identifier of who you are with your picture, your name, and your job discipline. There will be no facial piercings or visible tattoos, so all facial piercings must be removed. You cannot wear clear plastic holders in those piercing places. It has to be completely removed. For visible tattoos, we ask that you cover them, whether it be with a jacket or a long sleeve undershirt under your scrub top. That is all dependent on the colors. Again, you should reference your uniform guideline to see the specific requirements with color of jacket as well as the color of your undershirt. We ask that you be in assigned uniforms at all times. We expect for you to conduct yourself in a professional manner. We are a drug, alcohol, and smoke-free workplace that also includes our campus. So if you need to leave to take a smoke break, you actually have to completely leave our campus. You just can't go and sit in your car for that time. You have to actually completely leave the facility. For social media, there are two sides of this. There's the employee side as well as the employer side. So from the employee standpoint, please be mindful of what you post on social media, especially if you link us as your work location. Nothing about patients, even if you don't list their name or any kind of personal identifier. Please just say nothing about our patients. Make sure you keep work and personal life separate. That's your best bet. For the employer side, some of our clinics, we actually do have social media pages set up with the ability for our patients to make reviews on their experience. So please just be mindful that if you see a patient that seems to be upset before leaving the clinic, try and ease the situation as best as you can. If they're upset about a bill or whatever the case may be, simply offer them the billing number so that you're giving them the next answer, somebody that can help them with their problem if they can't fix it themselves. Excuse me. We have a zero tolerance policy for harassment, and we ask that you report any instance of harassment so that we can prevent that hostile work environment. For attendance, we ask that you be present and on time for all of your shifts. Accessing and securing the facility, the providers and/or the site managers are going to be responsible for accessing and securing the facility each day and night. For schedules, your supervisor will provide you with specific guidelines for scheduling processes at your specific clinic. So just be mindful of that. They're going to be in contact with you after you complete your orientation to set up your initial scheduling. Once you get into the clinic and get familiar with everything, they're going to go through how to schedule from there on out. In the instance of an emergency, say you can't make it to your shift, we ask that you first call your direct supervisor because they're going to be able to better guide you on who you should contact and what you should do. They may have a list of employees that are looking for additional hours, whether they be part-time or PRN status, so they can guide you to the person that can best help you in this emergency situation. For employee parking, we do have designated employee parking areas. We're not going to require that you park there on your first shift. It can be very overwhelming, especially if you move from clinic to clinic. We just ask that you park in an area that avoids the spaces near the patient entrance as well as the ambulance entrances. Those are clearly labeled on each of our clinics. So for clocking in and out, we have time clocks in all of our facilities. They're typically housed in the break room or right outside the break room in the hallway. You're going to first enter your employee number at that time clock. Your employee number is going to be the last 6 digits of your social security number. If the last 6 digits start with a 0, you're only going to use the last 5. So in this example, this person's last 6 of their social is 0, 1, 2, 3, 4, 5. So when they walk up to the time clock, their clock-in number is actually only going to be 1, 2, 3, 4, 5. Then you're going to simply press enter. You'll do the same thing when you clock out. You're gonna walk up to the time clock, enter the last 6 digits or the last 5 if your last 6 starts with a 0. You're gonna press enter, that's gonna clock you out. It's a very easy process for clocking in and out. If the power's down or it doesn't look like the time clock's turned on, you can still enter in your number and it should hold it in the time clock. So if the power does come back or the time clock comes back on, it will be sent off at that point. So all of the information that you've sent to Human Resources through the onboarding process, as well as your clock-in information, payroll, and benefits, that's all gonna be housed in Ultimate Software, UltiPro. That is our Human Resources online software system. It is web-based and can be accessed from your home computer, your tablet, your cell phone, desktop, whatever the case may be. It can be accessed from any electronic device that has Wi-Fi capability. So to log into your UltiPro, you're gonna visit the website ew22.ultipro.com. You have to type in that EW22 to get you to the Premier portal. So you'll go to that website, you're gonna enter in your username, which will always be PHC, your last name, and then the last 6 digits of your Social Security number. Your temporary password is going to be your birthday. It's gonna be written as 2 days, 2 digits for the month, 2 digits for the day, and 4 digits for the year. Then you're simply gonna press login. You're gonna then be prompted to authenticate your device. So it's gonna look like this. It's gonna ask you for a delivery method. How do you want that 5-digit access code to be sent to you? We're gonna go ahead and plug in your email address as well as your phone number when we put you into the UltiPro system. So it'll have your phone number as well as your email, and you're able to select that delivery method. If you want it to come to you through text, through a voice recording, or they can email you the code. You select your delivery method and press submit. Then it's gonna ask for you to enter that access code. Again, it's 5 digits. You have 5 minutes to enter that code. You're gonna type it in where it says enter access code here. You can check the box that says do not ask me for codes again on this computer for the next 30 days. However, if you change your device, it's going to continue to ask this code. So again, if you move from your laptop to your cell phone, it's gonna ask to send this code each time. This is an extra security feature that we have put in place for UltiPro, and this is just to make sure that it is you logging into your account each and every time because we have so much of your personal information housed in this system. So again, you'll enter the code, you're gonna press submit. When you first log in, it's gonna ask you to set a permanent password and answer a few security challenge questions, but then you'll eventually get to your home page. So this is what your home page will look like. It'll have your name with your title listed as well as your badge picture. You'll have your last pay statement available for you to view. You can download, save it to your computer, or print it right from there. We do not mail our pay statements out because you can access them online 24/7. So you can view your pay statement right there. You can go over to direct deposit, view your current bank account that you have set up. In UltiPro, you can make changes to that account, whether it's how your money's being deposited to your checkings or savings, or if you need to change your bank, you can do that as well through the direct deposit icon. Your contacts, that's gonna be your emergency contact as well as your dependents or beneficiaries. That information will be plugged in under contacts. You can make changes to that as well. Your name, address, and telephone number, you can click on that box, it'll pull you to all of that information. You can edit that information there. And then you can set goals for yourself. You and your manager can work on that, and you can set goals in UltiPro and they'll be housed in the system. You can make edits to all of this information at any time, however often you would like. It's gonna come to us in Human Resources for approval to make sure it is you making these changes, but it's a quick fix. Once it comes over to us that you've made the change, we can typically verify it right away, make sure that it is you. If you're changing your name or specific direct deposit information, we're gonna reach out to you for additional information, whether it be a license or social security card and a reason for the name change, or if it's specific to your bank, we need to make sure we have the proper banking information and it's you that you've added that bank account. If you go between each of the sides here, we have these arrows on our UltiPro page here. You can see if you toggle between these black arrows, it'll take you from your UltiPro homepage to your UltiPro news page. So on the news page, we're constantly updating this, a lot of times with benefit information. We've updated with 401k notices, specific to your health insurance plan. We also update with a lot of compliance things that are coming through that we need to send out to our employees. We do have our HR and payroll contacts. You can press on the More tab and it'll drop down all of our contact information with our direct lines, our email addresses, and what you can contact us for. All of that can be accessed there. So you'll see at the top of your page, you're gonna have these green tabs. On an employee, you're really only gonna have the Request Myself and My Company tab. All the other tabs that you've seen here and before, that's for a human resources employee. But you'll have Request Myself and My Company. Under the Request tab, you're really not gonna do anything. We have our own email system that we use our requesting processes through. On My Company, you can hover over that, click down, and you'll pull up an employee directory, so you can search for any employee in the company. Say you want to look for somebody with the last name starting with P. You can go to last name, press P, and it'll pull up every single employee that has a last name starting with P. All of our employees are set to private. If you go into your AltiPro account, you can make your contact information public. At that point, employees could view your information publicly, whether it be your phone number or a secondary email address. But you're gonna spend most of your time under the Myself tab. We have the personal information plugged in on the first column, so your employee summary, which has name, address, and telephone, your status key dates. So a lot of employees wanna know what's their hire date. It's the day that you do orientation is your hire date. So that may be something that you forget later down the line. No problem, go to status key dates, it'll pull it up for you. Your contact information can also be checked here. Your private information is going to have your social security and date of birth. Identification documents, we don't really house them on AltiPro, we house them here in our company files, but we could have the option to put it there as well. Under jobs, it's really important that when you first log into AltiPro, you check this, make sure all this information is correct. Your job summary, what your job title is or your job disciplines listed correctly, your compensation's correct. Sometimes we have managers that speak with you privately about additional compensation processes that might come to us directly. So you just simply let HR know if the compensation does not seem right, and we're able to meet with your manager and make that change if needed. Okay, so be sure to check that information. Under career and education, again, you can set goals and type in your personal information here, add your talent profile, some personal development processes. We're gonna plug in your licensures under licenses, and we're gonna plug in your drug screen and TB test under the test portal. Under pay, you'll see current pay statement, pay history, year-to-date, and direct deposit. All of that can be viewed there. So your pay history, that'll be from the first paycheck you receive from 10 years from now. So you can constantly see your pay statements, print them, save them as you need them. Your year-to-date summary, that's gonna give you a snapshot of how many hours you've worked year-to-date, as well as the amount of money you've made, also the amount of taxes you've paid out, and for the benefits side of things, if you're full-time with us, you'll see a screenshot of how much you've paid into our benefits. Again, you can access your direct deposit information here, make changes as well. For income tax, you can see your tax withholdings for state and federal requirements, and you can make changes to those at any time, however often you would like. When tax season comes around, you can print your W-2 straight from AltiPro. We will mail those out to each of our employees. If you need it before the time that we mail it out, you can go ahead and print it straight from here. For benefits, if you're on full-time with us, you'll be able to readily see your current benefits listed under the current benefits tabs, as well as your beneficiaries and dependents. If you need to make any changes to that, it's actually gonna have to come through me, and we can make changes, fill out any necessary documentation. For the Life Events tab, that's actually gonna be how our full-time staff enrolls in our benefits, is through that Life Events tab. So you'll simply click on there, press that you are a new employee, and it'll take you through each of our benefit plans. It's a very easy process. Everything's already pre-calculated for you because your salary and your age is plugged in there, so you're able to see how much you'll be putting into each of our benefit plans. You can make changes throughout the Life Events, all the way until you press submit. Once you press submit, if there are any additional changes that you would like to make and it's before the due date, you can simply just reach out to me and we can make those changes right away for you. But one thing you're really gonna wanna focus on is that time management under the second column there that's highlighted. So if you click on time management, make sure your pop-up blocker is turned off, then your time card will pop up and appear. If you have a red square on your time card, that indicates that you have a missed punch. So it's very important that you let your supervisor know of a missed punch on the Monday of pay week by 12 o'clock p.m. I encourage all of our employees to send an email to your direct supervisor in regards to this missed punch. That way you have a time-stamped document stating that you have turned in this missed punch before the required deadline. If you're a provider, it's important that you contact our payroll specialist, Tashika Robinson. We have her email listed there, and she will be able to fix your missed punch before the deadline. So specific to payroll, we are paid on a bi-weekly basis every other Friday. So again, the Monday of pay week that you're to be paid that Friday, you should let your direct supervisor know by 12 o'clock p.m. on Monday. Your checks are going to be issued via direct deposit, and as I mentioned, you can see that information on Ultipro and make changes there. As I mentioned, you can update your Ultipro at any time, however often you want. These are a few items you can change, but we've gone through the many different areas that you can change. We will be required to withhold state and federal taxes. You can make changes to those tax withholdings in Ultipro at any time. We will be subpoenaed to withhold garnishments, child support, and IRS levies. For employee benefits, our full-time employees are eligible to receive our health insurance, which is currently through Blue Cross Blue Shield, our dental insurance, which is through Principal, our vision insurance that is through Principal, but it's a product of VSP, our voluntary life insurance through Principal, and our voluntary short-term and long-term disability through Principal. The great thing about our new employees is that you are currently in what we refer to as open enrollment. So you are able to access any of these plans, no questions asked. They will be effective on your benefits effective date. Once you get into open enrollment, if you have waived all of your coverage at your new hire period, you will have to go through a process where the vendor will actually have to approve your effective date for your coverage. We do offer supplementary insurance plans through Aflac. You will receive paid time off and paid holidays if you work at least 36 hours per week. For 401k, all of our part-time and full-time employees are eligible to start contributing to our 401k plan after 90 days of employment. So you have received the nationwide enrollment book. At 90 days of employment, you can go ahead and flip to the back of that book starting on page 50, and we actually have the enrollment forms for you to fill out, and you simply fill out those forms and return them to me. You've also received a summary of service providers document. On that document, it has Horizon Wealth Management. They are our financial advisors that are free of charge to our employees. So you can reach out to them, their phone number is listed on that sheet, and you can contact them about any specific investment options and really kind of just get familiar with our 401k plan. They'll let you know if they think it's a good idea for you to invest in our plan and what you should do with previous funds if you have a separate job or another 401k plan. Once you have made 12 months with us and you've worked at least 1,000 hours, Premier will start contributing to your 401k plan, and they will contribute up to 3% of your annual salary each year. So something very beneficial for you to look into, especially as you start the process and the hours worked. So some of our part-time employees do qualify for that 1,000 hours requirement where they're able to have Premier Health contribute to their 401k plan. Your benefits will be effective the first of the month following your 30 days of employment. So you'll hit your 30 days of employment, and then the first of that month thereafter, your benefits will become effective. If you need to make any additional enrollments or changes to your plans, that can occur during annual enrollment, which is typically during October or November of each year. Those plans will then be effective January 1 of the following year.